Can I just ask the officers what their views are on that, going from redeveloping to just using the word strengthening? What's your view on that? You happy with that? Yeah. Okay. We'll change
and so
that.
am I, Mr. Chair. Thank you.
Okay. Thank you, Councillor Brewer. So, look, I just want to say that I was involved as the chairman of the Community Safety Forum. We had forums back in the last term of council with work on a smoke-free policy and bylaw, but it was former councillor Sandra Coney, who was the chairman of the Parks Committee, seemed to have a different view, and I think she won out in the end of the day. It was a non-statutory process. There was no bylaw associated with it. That was what the council wanted at that stage. I thought it was a toothless tiger kind of approach to dealing with the smoking issues, but people around the table at that time agreed with Sandra Coney, and that prevailed. And we've now moved forward, 3 years, 4 years, and I think it's now thought that we can get better outcomes if we do now strengthen the policy and also work towards the implementation of a bylaw. Because I think that the non-statutory approach is very important, and also I think that the bylaw approach can be looked at. But as we've said here today and we've heard today, it's enforcement of the bylaw if we implement it, and also the cost of the signage. Because with the alcohol-free areas, with that signage, I think if we did that to the full extent that other councils have done across New Zealand with signage, with maps on, and other information, I think it was going to be about $6 million, whereas we had to, because of the size of Auckland, the size of the council, the restrictions on our budgets, we had to truncate down the approach and the signs. I think we have generic signs, we've got generic times. We don't have different.
We'll have different ones with the local boards.
And so I think, you know, and the local boards had quite a bit of input. So I think that we've obviously, with this approach that we're now talking about here, it has to be coordinated, it has to be across the council, ensuring that the local boards come on board especially. So I think this is a good way forward. It really probably is the direction that I was hoping we would go in 2011, 2012, and I think that we've probably lost a little bit of time, but it's something which I ask councillors to support. Thank you. Councillor Darby.
Thank you, Chair. Are you incorporating the B and the C? If not, I'm happy to second, but I guess...
We've incorporated the B and the C.
You've incorporated the B and the C?
Yeah.
Thank you. So, look, I support that direction, and thanks for your work on this, Mr. Chair. I look at the death rate as just phenomenal, and this is something that we just cannot shy away from. And if you just break out the Auckland numbers, it's at least 1,600 premature deaths from smoking just in Auckland. And that's a scathing statistic, you know. That's something that you really need to be on top of, you need to be discussing, you need to be taking action. But then you look at the cost that is imposed through the healthcare system in the billions or billion plus. That has massive societal impact as well, and it hits, you know, every family budget through the need to assign such enormous budgets in response. And yes, we're doing pretty well, but we're still not going to hit that 2025 target. So I would say let's keep our 2025 target and make sure we do hit it, and we hit it in all the demographic categories. Not just the societal cost, but the family cost is phenomenal as well. You know, I think Councillor Cooper, you were alluding to just how much could be back into family budgets if parts of the family weren't having to expend on not just the cost of smokes, but actually the cost of their private health care to address the health impacts, the personal health impacts. I'm intrigued to look at sort of the analysis of the cons of the bylaw, but and thank you to the team. but they could be applied to any bylaw that we might put in place, you know. So they're not actually specific to this bylaw. They would be applied, you know, we could be rejected by legal experts, we could be, attract major legal scrutiny. That goes for any regulation that we could be putting in place. So I think we need to be big enough to look past all those sort of cons and implement this. It's critical that we just continue down the track of denormalising at an accelerated rate smoking. It's just not cool to smoke. Until recently, it was pretty cool. But we need to make it faster uncool. And this review, the strengthening and the bylaw does that. And it also complements the non-regulatory approaches, and it underpins the government's direction and commitment as well. And there's a lot of partners we're lined up with here, and we've had a lot of them here at our public table today, and I acknowledge them all. But we have one big partner, and it's 1.6 million Aucklanders who want us to do this. And all the surveys say they want us to move in this direction faster, and that's the public of Auckland. So I commend us all for taking these steps today.
Thank you, Councillor Cooper. Just councillors, there's just a small word. Louis just been and spoke to the staff in relation to where the 2025 goes in, and he's strengthening our existing policy and framework and intent to 2025. So that's you happy with that? Okay, thank you.
Yeah, I'm happy to, Mr. Chair.
Yeah, thank you. Councillor Cooper.
Thank you, Mr. Chairman. Thank you for the report. I mean, my comment is, if we stripped out the money to actually implement, how did we, you know, why do we need to rewrite it if we never let it fulfil its potential in the first place? I think there's some other things we can put in there now, a new context, but you know, it's no good us writing policies if we're never going to implement them as well. So I mean, that's a caution for us. The other issue I'm very concerned about is once we start getting this all around the place and then the local boards have their say, etc., I don't want it ending up like the dog bylaws, where we have different times and different places and so many different rules that nobody knows what's happening, and the cost of the signage is so horrific that then we have to pull it again, just like the dog bylaws. So this is the issue. We're making a regional policy. I'm really happy for input all over the region, the local boards, but we can't let it be then taken away again for different signs in every different place and a different set of rules in 21 local areas. It isn't workable, and the public gets so confused, you know, and then that's where we hear people's anger of spending a lot of money that we don't need to spend as well. You know, people need to have consistency to understand things, and if we haven't learnt by the dog bylaws, you know, and how we've managed that in a local context, well, we're not listening. So that is a concern for me. If we start doing that, it should be nothing to do with hours. You just don't smoke there. If we decide it, there doesn't need to be no inconsistency. The other thing, and I did bring it up, the whole issue around, you know, this is wider than just health. We're talking about people affording rents. The same people, Pacifica and Māori, who are struggling with rents on low incomes are often, and I'm not saying everybody, but I'm going to be brave and say this because I've worked in the health sector. I've worked with people that can't afford food for their kids, and then they're saying, and they're smoking 2 packets of cigarettes a day. And when they've stopped, they've said to me, my God, I can actually afford food for my kids. So this is a huge issue, and rents and things like that. So this is quite multifaceted. It is so important that we help encourage people to stop smoking, and if we can do our part, that's really good. But one thing I must say, and I've brought it up over and over again in different committees, is that if we can't do it on our own patch, we can't tell other people. Consistently, every person that comes into our back door in our car park goes past our neighbours in Federal Street, the people that work in Federal Street, popping into the entrance to our car park and sitting on the little ledge there with their coffee and their smokes, and they smoke. And we all go past it every day, and it's our building, and we're not even got a little sign that says no smoking. So if we're going to do this, we've got to walk the talk. And I know that's a tiny thing, but it's just an indication, you know. So for me, it's about health. It's about amenity for people, you know, that we can sit and have a nice meal or be at a beach or whatever and actually enjoy it without having to run the gauntlet of inhaling other people's smoke. So, and children having to do that. So I support this. I do question the need for a bylaw because how are we going to enforce it? But I do specifically support the fact that we don't have to rewrite the whole policy. We need to build on the good work done, and we actually need to put our money where our mouth is and put that money in the LTP to implement it. Otherwise, we're wasting this money in doing this. Thank you, Mr. Chairman.
Councillor Crum.
Can I just quickly clarify before I speak on a point that Councillor Cooper's raised? So in option 1, it had the wording develop a new resourcing model. Is that now excluded in what we've got here, or is that the general intent is there?
Through the Chair, as I noted earlier, all 4 of the options that are presented in the report had that implementation budget included within it.
Great, thank you. I think we should start with the positive, and the positive is that we do have the most comprehensive smoke-free policy in the country, and that the team, the staff team, have done a fantastic work in confirming that our current framework, our intent, is effective and can be supported. So what we've done well, and I think that we need to keep an eye on that as we go through what is obviously some significant and some well thought out and well needed tweaks and changes. Part of the primary issues, right, that you've identified is insufficient resources and lack of support for local boards. So just on that local board note, my understanding is that it's really important that we include that C because of the need, and something else that Councillor Cooper's raised, that regional consistency. We do need local boards to know quickly and easily what they can and can't include, what they can ask for and keep track of in terms of smoke-free requirements when they've got events and contracting going on in their areas. So I think that C is incredibly, well, I hope it will be incredibly helpful and important for us as a region and answer some of the concerns that local boards have been raising consistently. The non-regulatory approach, which we've had encouraging behaviour, it does work, but only to a certain extent, right? It's about human behaviour, and having a deterrent really does help. It's why the price of smokes has gone up so monumentally. So for those, along those lines, it's why I supported the introduction of a bylaw. I think we need to send a very clear signal, simple as that. Community norms have changed. You've raised that point, Councillor Darby, and we need to get with the times, basically. If community norms have changed and smoking's become uncool and we know the health risks, then what are we doing about it? And so this is a really good and significant step forward. I think there's a number of us around the room that would like things to change tomorrow. We could whack in a bylaw tomorrow, but that's not going to happen. We need to do it the right way, and the wording here takes people on a journey. The number one goal, as far as I'm concerned, is clarity for the public. They need to know where we stand as a council, what is in, what is out in terms of where they can smoke, and that's what we will eventually get to. And so I look forward to this particular motion passing, and thank you for everyone's work on it.
Councillor Casey.
I wanted to talk about C. I mean, today's great, but C is even greater. But you've just snuck some words in there, George.
Yeah.
Can you explain that?
Well,
the
officers have indicated that we don't have any jurisdiction in relation to non-public areas.
Okay.
No, so people obviously, if events are being held and they're not open to the public, well, we can't Grant, this
No,
is
that's
from
fine. I
Mr
just
Barnes.
couldn't read what you'd snuck in.
Yeah, yeah.